The question is, how can you push single payer in the Democratic caucus when all the Democrats are taking a kind of timid view of this? I am not only a labor lawyer, I'm a writer. I write in national publications like the New York Times. I've got the cover story in Harper's Magazine, which some of you may have read. And I have written a lot about economics. And one of the things that I want to do with the single payer issue is to explain to the political class in this country that they can't get out of this economic situation they're in unless they address single payer. Their view is, we'll keep everything more or less the same, and we'll have a stimulus bill, and that will get the economy moving again, and we'll spend a lot of money to the banks. But that just puts back in place the old system that we had. And the old system was killing us. Under the old system, there was a huge trade deficit. And that trade deficit clobbered the Midwest. And you all feel the consequences of that because that all plays back on the county hospital. There's a kind of boomerang effect on public hospitals and public services as the private sector industry goes down. Here's the point. I'll make it as simple as possible. Unless the government takes over the health care costs from private employers, we're not going to be able to be competitive and do something about that trade deficit, which is taking jobs out of the country. So here's the problem, Democratic Party. If you want to get out of this economic crisis we're in, you've got to do something about the trade deficit, right? Right. And the only thing that the government can do about the trade deficit is to subsidize private employers in some way, right? Right. And there's only one legal way under the World Trade Organization and the free trade regime and the global economy. There's only one way that the government can subsidize private business, and that is to take over health care costs. You can't give bonuses to have them export, but you can come in and take over health care costs. Right? Right. So there's no other way to get out of this crisis that we're in than going to a system like single payer. Right? Right. So in 4 years, when the Democratic Party, when the Democratic administration runs again, they better start taking steps to take over a single payer. And even the stimulus bill, is, as you know, is increasing Medicaid eligibility and so forth. So there's kind of this double think. On the one hand, the Democratic Party doesn't want to go, or the Democratic leadership doesn't want to go to single payer. On the other hand, the logic of the economic situation we're in is forcing them incrementally to single payer. My argument is going incrementally there isn't enough. We've got to go there in a big way. I think that if we put the single payer issue on this level of a life or death issue for the future of the Democratic Party, that it will start changing minds. I'm going down there to Congress to make that case with your help. Let me go down there and argue for you for single payer and push this issue at the center of the Democratic Party's agenda where it has to be. That's the goal. Don't let them get away from it. And that's why I'm running.